we'll have, unfortunately, we are running late, so I'm not sure how much of a live Q&A we'll be able to do. But people are all encouraged to write their questions in the Q&A chat box, right? And so please, all the presenters, please do your best to answer the questions that you see in the Q&A chat box as we go. And then now we're going to move to the panel session because of lack of time, right? So let me, we have three excellent panelists. We have Mr. Christopher Horneck from ICAO. We have Mrs. Lucy Young from Linux Foundation, and we have Mr. Woojin Jong from Republic of Korea and the Korea Disease Control and Prevention Agency in particular. So let's learn a little bit more from them. So first, Mr. Horneck, if we could hear from you in terms of what ICAO, I never know how to pronounce ICAO or ICAO, what is ICAO doing in this area, and maybe to the extent possible related to what the WHO and maybe the EU or even the Indian system is doing. Thank you. So please keep it within 7 minutes as we agreed, right?
Great, thank you, Jan. And hello, everyone, and thank you for inviting ICAO or ICAO to this meeting. It's our pleasure to be with you today to give you an executive briefing about what ICAO's work has been on developing specifications for international health proofs. And in doing that, we've certainly utilized and redeployed the existing trust framework for electronic machine-readable passports. So those specifications, those health proofs clearly apply on the one hand to vaccination, proof of vaccination, proof of test, and proof of recovery. But for this quick and executive briefing, I'll just focus on vaccination to make it as clear as possible. And in that sense, I can lead off right away that the ICAO data set for proof of vaccination has been derived completely from the minimum data set recommended by the World Health Organization. That's something I'd just like to stress right at the outset. Here, a quick overview of what it is that we're talking about. As ICAO, we, as an international civil aviation organization, focused on, of course, also promoting cross-border travel, tourism, and of course, aviation as such. We have created a specification, not a solution, but a specification that is meant to create a very specific token for cross-border travel. And that's why we've integrated that into the existing, as I said, the existing trust framework for passports or machine-readable travel documents. Now, in doing so, our objective at the very outset was to achieve global interoperability. And for us, that means already at the outset, thinking about the problem of a vaccination, proof of vaccination that has been issued in Peru, but needs to be verified in Russia. So something that is not really related to each other, just like a passport might be. That's really the argument that we put at the outset of this in developing the specification. Now, like others, this is a digitally signed 2D barcode. And in saying it is a 2D barcode, of course, it can be issued in paper format or in a digital format. It can be also digitally signed. Not only it can, but in the sense of a vaccination, according to our specifications, it shall have this digital signature so that the authenticity of that barcode can be verified. And in saying it is a barcode, also the specification is as broad as possible. It includes the ability to include it, to issue it as a QR code, as a data matrix code or as an Aztec code. Importantly, it relies on the existing ICAO trust model used for e-passports. That's deployed since 2004, and it uses a two-level public key infrastructure in which states themselves, member states, vouch for the authenticity of their credentials. In that sense, the specification is flexible because we encourage strongly that, for example, we have 145 states already that have invested into this technology that are issuing electronic passports. And they could use that same, as we call, root of trust to issue also their vaccination certificates. Now, of course, the flexibility in that is they do not have to reuse that root certificate of passports for their vaccination credentials. They could do so because it certainly would be more cost effective, but they could also choose to establish a new health root certificate to then issue and sign their vaccination certificates. The 2D barcode is very flexible, as I noted, includes 3 different types of specifications, the QR code, data matrix, and so forth, and it can be easily read by at least 99% of the barcode scanners that are deployed around the world in airports and other locations. We've even gone so as far as to test the VDS at a type of a grocery store level of a barcode scanner. It is easily readable around the world. It also includes the JSON text, which is a very technical specification for JavaScript object notation. It's lightweight data, which allows for this human readability of the barcode data without the use of software. So, of course, software also enhances the readability of that, and of course, the verification of the data and the verification of the authenticity, but it is not strictly needed. And critically, the entire specification really was designed for immigration and for border control. From the ICAO perspective, in terms of reopening borders as we get out of this crisis, that offline verifiability is extremely important to us. And as I noted, is a 2-level PKI infrastructure in which the barcode signer is contained on the token itself, the VDS. Now, really briefly, we call it the VDS-NC, the Visible Digital Seal for non-constrained environments. That's a long and technical title. That's not so important. But this technology has already been deployed, ironically, by the European Union, the Schengen visa, in the sense of that ICAO trust model for digitally signing e-passports was then extended to the barcode that is being placed on EU visa stickers. Now, obviously, a visa sticker is a very small piece of paper, whereas a vaccination certificate can be issued, as an example, on a much larger piece of paper, and in that sense, we call it non-constrained. That gave the specification far more flexibility in terms of also adding the barcode signer to that document, making it, of course, offline verifiable. Now, what the VDS-NC is not, it is not the primary medical vaccination document. That function clearly stays within the health-related environment. In fact, our overall goal is not we don't want to replace any type of national or multilateral health or vaccination documents. We want to ensure that these documents that have been issued in one state are readable and verifiable in states all around the world. And that's as a UN agency and as ICAO is our goal. And in that sense, we wanted to base that trust framework, that ability to verify those documents around the world, on existing and already deployed technology. As I said, 145 states already have this PKI in place and can easily repurpose it for their vaccination certificates, or choose to use the same specification to issue a new root of trust that is grounded in their, let us say, their health ministry or a similar function. Now, what issue and what problem are we addressing? Clearly, and again, like the other speakers before me, ICAO has not adopted the policy that a vaccination certificate is a requirement. This is a technical question that we're addressing, although recognizing that states are requiring health proofs such as vaccination from international passengers. Now that clearly is complex because that certificate will be issued in one state, but will need to be verified in another state on arrival or through a portal. And critically, from our perspective, before departure. So this pre-departure verification is also one very critical issue that as ICAO we are looking at. We are looking, and that is another reason why we would like to repurpose existing infrastructure deployed for travel documents, something that the aircraft operator has experience with. That is a critical problem that we would like to address, and we want to help solve with the deployment of the VDS-NC. In saying this, we already have a number of solutions that are deployed around the world, and specifically those solutions are end user tools which the customer, the traveler interacts with or has on their mobile phone or their smart device as a way of presenting their vaccination certificate. We are not proposing a solution to replace any existing tools. What we are seeking to provide is a specification to achieve global interoperability among solutions, thereby assuring common performance and security standards. In a very similar way, I believe, as we've done for machine-readable travel documents.
Thank you very much, Christopher. Is that your last slide, or can you
I would like to just conclude here is that, again, our trust framework is deployed by 145 states issuing electronic machine-readable travel documents. This VDS specification allows the digitally signed 2D barcode to be easily read and validated in a similar way as the passport in an offline mode. And I think critically here, I would like to add that, again, our argument is that this is designed for verification by frontline immigration or border officials who to date have not dealt with the vaccination certificate. When I returned to the European Union this August, I possess a DCC myself. It was uploaded to a portal and the immigration officials never saw this. But I think from an automation and an integration perspective, when we look at a seamless procedure where one entity in an integrated border management framework is responsible for checking entry requirements, these are the arguments that ICAO is pursuing to help support not only aviation, but of course, the opening of borders, tourism, and trade that is associated with it.
Thank you very much, Christopher. So no, I think this is very interesting, and then it's very important to that everybody is very much aware of ICAO solutions, right? Because there is interlinkage between what is WHO doing, what is the EU doing, which actually has focused now on freedom of movement, which is also exactly the same thing that ICAO is trying to do, right? So thank you very much for the presentation.